So beyond just the root canals, and what about other amalgams, fillings that people have?
Well, it all relates to toxicity. Okay, mercury is a very well-known toxin, and it's pro-oxidant. Many of the materials used in dentistry, while they have wonderful mechanical effects, they're durable and they stay in there and they last. They're also made of other toxic metals, namely nickel, stainless steel. Long ago in orthopedic surgery, they stopped using nickel in their various appliances because nickel is well established to be one of the most carcinogenic metals known to man. But dentistry hasn't slowed down one bit in putting nickel at the bases of crowns and other areas, in braces, in dentures, you name it. So you have mercury, you have nickel, you have other toxic chemicals that are part of the fillings and this sort of thing. And when you make an intelligent selection, you can find materials that are strong but don't have these toxic qualities. And of course, you have the root canal we just talked about. When you have infected gums, periodontitis, that can be like having 30 root canals because it's all sitting there producing toxins around the clock. And you have the infected pockets after extractions that are in there an incredibly high percentage of time. For extracted old wisdom teeth, most people are going to have these infected pockets of what I call, because this is what it is pathologically, it's a pocket of wet gangrene inside your jawbone. It tends to be a little less toxic than the root canal because what are you doing with the root canal? You're chewing on the tooth and you're pressing into the blood. The cavitation in the jawbone, you're not generally putting a lot of pressure on it all the time because it's just an area that's unopposed by another tooth and you're not getting the physical pressure. But nevertheless, pathologically, that's what it is. And for some people, these cavitations are of enormous consequence for them to regain their health. And then, so we have to remember what we're impacting here. All toxins lower or neutralize antioxidant levels. And antioxidant levels are really our main defense against all chronic degenerative disease. When our antioxidant levels drop and stay down due to whatever your genetic predisposition is, high blood pressure, cancer, heart disease, collagen vascular disease such as lupus, all these things start to appear because you don't have the antioxidant protection. So this is why the dental toxicity is so important, because it will be the root cause, no pun intended, of a lot of different diseases depending on genetic predisposition. So when I lose my antioxidant protection, in my own personal history, I started to develop elevated blood pressure, which, although it didn't make me happy at the time, it was better than getting a cancer as my first manifestation of lack of antioxidant protection. So in a sense, it was a good warning sign for me when I started becoming more educated on what's happening in the body physiologically. So that's why you need to, in my opinion, address dental toxins first.
Okay.
And for anybody watching this little interview, I will say that in my clinical opinion, based on all the evidence I've researched, based on all the patients that I've seen, based on the many doctors that I've talked to, the number one cause ultimately of the vast majority of cancer and the vast majority of heart disease is the presence of one or more root canals.
Wow.
Because of the toxic impact, it is the number one. Dr. Joseph Issels, in his German clinic back in the 1950s, was seeing advanced cancer patients from around the world, and he found that there were either root canals or other infected areas, and we're talking about the root canal as an infection, in 95% of his patients. So it's not something 95% of the population has, but when they have it, this is the impact on a very high percentage of people.